The second talk in the plenary was interesting by Professor Mark Hayter, where he was talking about the idea of one-stop shops. Now, will declare that I'm a GP, so I tend to be in two different camps on this one. I believe that the GP is the one-stop shop. This is the one place where you can get as many services brought together as possible. And sometimes one-stop shops, they work great as long as the communication is there between primary care. But I think primary care is in one of the absolute best positions to be able to provide these one-stop shops. The data's quite good. It's looking at what other interventions can we bring together. Sexual health and reproductive health, those two go really well together. Drug and alcohol services and sexual health, these two go very well together as well. Also, the idea of introducing one-stop shops in places where they're needed, i.e. schools. So should sexual health education be part of a school, including like a nurse that's able to do sexual health screening? The data shows that it is acceptable within the systems. It's better to be phrased as a health service rather than a sexual health service, and that can reduce stigma and also reduce other sort of, people feel more confident in using a service if it's not going to be purely sexual health, or it's purely reproductive health, and I think that's really good. But I think that we really do need to look at the idea of how can we integrate services as well together. This will lead to cost saving, but also a greater throughput, because people ultimately want to have one doctor who can provide all of those services. GPs, just saying. So I think this is a really good idea, but I really do think that it's important that we look to the people who are very good at doing this one-stop shop. Let's talk with the primary care physicians and see how can we all work together and bring this into a really good intervention